Behind me I've got one of the electric cargo bikes. The bike has the ability to carry a lot of extra equipment, and being electric is able to cover a large range and radius for us to make some of our visits that we need to in urgent care cases. And to take this project forward, Cornwall Council have awarded Kernow Health a grant to purchase the bikes as part of their travel to work scheme, and they're funding a significant proportion of the bike cost and therefore reducing our startup costs into this project. So we're currently delivering a trial in the Newquay area with the electric cargo bike. That's been sponsored by Fully Charged Cornwall, the bike shop, to help us get it up and running and the trial ahead. The bike has been trialled over different times. Predominantly the weekend is when is our biggest time of service. However, as part of that as well, over the summer you will see the bike work in evenings as well throughout Newquay, certain evenings, to see where we can collect data from this period as well, as it's another time of day that we cover throughout the year. Through the trial, we're looking at how many visits we're making on the bike, the range that the clinicians are able to reach, and that we're able to carry all the equipment we need to deliver the urgent care service that we're expected to deliver. At the weekend, we delivered our soft launch with the bike undertaking 2 shifts over the weekend. During that time, we did make 3 visits on the bike within the Newquay area, and the bike therefore has saved a lot of our clinical time. If clinicians would have been travelling in cars to these visits, we would have lost approximately anywhere from 2 to 4 hours in travel time. In addition to that, we've reduced the emissions of those vehicles having to travel that distance, and also we were attending the patients in a lot sooner time, as they were all within 5-10 minutes of our base within Newquay. The bike though does carry all the same equipment as our cars. So for the Newquay project, we don't have a car based here, so we're hoping to prove that the e-bike, having it located in this area, the patients will have a response that is sooner than waiting for a car to travel from another town. We're seeing increasing demand within the NHS across all services, and the e-cargo bike, having this resource, will allow us to make extra visits during our weekend and evening services, so therefore increasing clinical capacity. It has been great to be out seeing patients, getting out on the bike, cycling around the town. It allows us to engage and interact with the public, communicate and talk about the 111 services that we deliver in Cornwall, and also sort of educate and provide that public engagement. It's very rewarding as a clinician to have that exercise factor as well built into my day, and also I find it a nice refreshing balance between jobs to have that mindful gap that you need to prepare yourself for the next patient.